Hey there, future anesthesia rock stars. Welcome back to You Learn Anesthesia, your ultimate hangout for all things anesthesia. Today, we're diving into a vital topic for all anesthesia students and professionals. And no, it's not about how to master the art of napping while standing up. We're exploring something way more exciting: the universal induction agents, or the magical cocktail that guides patients into dreamland. Get ready to meet the superheroes of the anesthesia world. Spoiler alert, they don't come with capes, but they're just as cool. So grab your notebooks, and let's turn this learning session into a Marvel party. And remember, no napping in class. That's our job. Alright, let's get started. What are induction agents? Induction agents are medications used during the induction phase of anesthesia. They transition a patient from a conscious state to an unconscious state, preparing them for surgery or other medical procedures. These agents quickly induce hypnosis, amnesia, and sometimes muscle relaxation, ensuring the patient is comfortable and unaware of the procedure. Today we'll focus on the top 5 induction agents: propofol, etomidate, ketamine, dexmedetomidine, and methotrexate. First up, the undisputed king of quick onset, propofol. Spoiler alert, it's not just for Michael Jackson jokes. Propofol, also known as Diprivan, is a GABA agonist, famous for its rapid onset and smooth induction. It kicks the door down and sends your patient straight to dreamland in seconds. Here are the essentials, like a VIP pass to dreamland. The standard dose for adults is 2 milligrams per kilogram, but don't worry, you won't need to do any math in your sleep. This can vary based on individual patient factors, so always adjust dose for age, cardiovascular status, and premedication. It's like customizing your sleep playlist. For pediatric patients, doses range from 2 to 3 milligrams per kilogram. Propofol can be also used for light sedation. The MAC dose of propofol can range from 50 to 150 micrograms per kilogram per minute. It's like a slow drip of relaxation. Believe it or not, propofol is also known for its antiemetic effects. It's like the Swiss Army knife of anesthetics. The antiemetic properties of propofol are particularly useful in reducing post-operative nausea and vomiting, a common complication for surgery and anesthesia. The antiemetic dose of propofol is generally much lower than the dose for induction or maintenance, typically 10 to 20 milligrams as a single bolus intravenously as needed. Propofol works in 10 to 60 seconds, faster than you can say abracadabra, and lasts about 3 to 10 minutes. Just enough time for a power nap. Some side effects of propofol include respiratory depression, hypotension, myoclonus, and irritation at the injection site. Quick tip: always remember to give lidocaine along with propofol. Usually 40 to 50 milligrams does the trick. It's like giving your patient's veins a VIP pass to the no-burn zone. Trust me, your patients will thank you. Maybe not in words, but definitely in vibes. If you're using propofol for long-term ICU sedation, keep an eye out for elevated serum levels of lipids and other complications. It's called propofol infusion syndrome. Fun fact: propofol is basically a fancy smoothie made with egg lecithin, soybean oil, and glycerol to get it IV ready. But if your patient is allergic to any of these ingredients, it's time to ditch the smoothie and whip up a new recipe with alternative agents. No allergic reactions on our watch. So yeah, it's not all rainbows and unicorns. Okay folks, so we've covered propofol, the Usain Bolt of induction agents. Now let's slow it down a bit and meet etomidate, or amidate, the chill superhero who's all about keeping your patient's heart steady when things get a little wild. Etomidate, the heart's BFF, is also a GABA agonist like propofol, but has a different set of superpowers, especially when it comes to maintaining hemodynamic stability. One of its coolest tricks, it barely messes with blood pressure or heart rate. How awesome is that? This makes it super reliable, like your favorite pair of comfy socks. Plus, It causes less respiratory depression compared to propofol, making it a safer bet for patients with breathing issues. Breathe easy. Think of etomidate as a bodyguard who steps in, keeping everything smooth, calm, and in control while getting the job done. The induction dose of etomidate is 0.2 milligrams per kilogram, just a tiny bit of magic. Its onset is in 30 to 60 seconds, with a duration of action lasting about 3 to 5 minutes. Quick and efficient, like a ninja. Some common side effects of etomidate include painful injection, high incidence of myoclonus, and potential adrenal suppression. Prolonged infusion can also cause hypotension, electrolyte imbalance, and oliguria. Not exactly a walk in the park. So make sure to avoid etomidate in patients with adrenal insufficiency. No need to add fuel to the fire. Funny story. We once had a patient who thought etomidate was a superhero serum. He asked if it would give him super strength or the ability to fly. We had to assure him it was just for anesthesia. No superpowers, unfortunately. But hey, it does a super job at keeping you stable. Next, we'll explore a versatile agent, ketamine. Get ready for a wild ride. Ketamine, our analgesic adventurer, derived from PCP, is like the quirky cousin at a family reunion, unique for its analgesic properties and its ability to keep you breathing like a champ. This one has got more twists and turns than a roller coaster. Known for its mind-bending psychedelic effects, ketamine is like the party animal of anesthetics, offering both sedation and pain relief. It works its magic by blocking NMDA receptors in the brain, reducing pain perception and inducing a trance-like state. It's often paired with propofol to create the dynamic duo known as ketofol. This combo delivers the best of both worlds while minimizing their individual side effects. Dosing is usually 1 to 2 milligrams per kilogram intravenously, or 3 to 5 milligrams per kilogram intramuscularly. It kicks in faster than you can say hippopotamonstrosesquipedaliophobia. Oh man, that's about 30 seconds. And it lasts for a quick 5 to 10 minutes, just enough time for a great nap. Another interesting tidbit is that its liver metabolite, norketamine, is an active metabolite, but less potent. But watch out. Ketamine can cause hallucinations and make you drool like a teething baby. Pre-treating with benzodiazepines can help keep those trippy effects in check. Also remember, ketamine is a no-go for patients with high blood pressure and high intracranial or intraocular pressure. For example, patients with closed head trauma. Okay now, let's move to a relatively new player. Dexmedetomidine, aka the Delirium Buster. Sounds like a superhero, right? Imagine ketamine as a wild roller coaster ride. Exciting, fast, and sometimes a bit disorienting. Dexmedetomidine, or Precedex, is an alpha-2 agonist. Unlike other induction agents, Dex isn't in a rush to knock you out. Instead, it works its magic through the body's natural sleep-promoting pathways, like a Zen master gently guiding you into a peaceful state. It's the type of sedation where you can still stay aware and responsive, perfect for when you need that calm, relaxed vibe, but want to keep the patient breathing easy. Historically, Dex is used in ICU sedation. It's the chill pill for the critically ill. But most recently, it's gaining popularity for its superpower of offering sedation without deep hypnosis. That's right, it's a sedative that won't make your respiratory drive take a nap. This makes it the go-to choice in the ICU or for patients who need some sedation but can't afford to lose their ability to breathe. And hey, Dex has a little bonus superpower. It helps prevent post-op delirium, especially in elder patients, so you wake up feeling like $1,000,000, not a confused duck. But wait, there's more. Dex is great at keeping your blood pressure and heart rate in check. It's like having a calming influence on your entire cardiovascular system. So, for those patients who need a little extra stability, Dex has your back. The dosing of Dex involves a loading dose of 0.5 to 1 micrograms per kilogram administered over 10 to 15 minutes, just enough time to meditate. If using as an infusion, 0.2 to 1 micrograms per kilogram per hour may be needed, like a slow drip of Zen. It has an onset in 5 to 10 minutes, lasting 1 to 2 hours. Side effects include bradycardia, or as we like to call it, the slow and steady wins-the-race heart rate, and transient hypotension or hypertension, usually in the beginning, but it tends to level out over time. So keep an eye on those vitals, folks. Plus, these effects are also dose-dependent and can be avoided by decreasing the loading dose or increasing the administration time. Because let's be honest, nobody likes a roller coaster ride. And now presenting methotrexate, the ECT specialist. This one is the go-to for electroconvulsive therapy, or ECT, making sure your patients stay sedated and safe during the procedure. It is the superhero barbiturate, swooping in to save the day with ECT by lowering the seizure threshold, making it the perfect sidekick for ECT. Zap! The typical dosing of methotrexate or Brevital is 1 to 2 milligrams per kilogram administered intravenously. It acts within 30 to 60 seconds and lasts for 5 to 15 minutes. It may cause psychomotor impairment for up to 8 hours. Some side effects include hypotension, myoclonus or involuntary muscle jerks, and nausea and vomiting. Also, methotrexate can decrease the seizure threshold, which means, while it's a star for ECT, it might not be the best choice for someone who already has a history of seizures. And here is a pro tip. Steer clear of methotrexate in patients with porphyrias. They're not fans of this particular agent. Alright, anesthesia superheroes, let's wrap it up with a twist. Imagine our induction agents as characters in a Marvel movie. Here we go. Propofol, that's your Usain Bolt, the fastest agent on the block, swooping in for a quick, smooth induction. He's like the Flash of anesthesia, swift, reliable, and always gets the job done. Etomidate, think of him as Iron Man, cool under pressure, always stable, and perfect for those hemodynamically unstable situations. He keeps the heart and blood pressure in check while delivering reliable sedation, just like Tony Stark keeps everything running smoothly with his suit. Ketamine is the Doctor Strange of the group. A little wild, a little unpredictable, and full of strange, mind-bending powers. He provides not only sedation, but pain relief, and you can always count on him in emergencies when you need to keep patients breathing and stabilize them in a pinch. Dexmedetomidine, or Dex, is our Black Panther, calm, collected, and cool under pressure. He's like the Zen master, maintaining stability without knocking out your breathing, and it's especially useful for elderly patients, preventing post-op delirium. Total class act. Finally, methotrexate is our Thor, the hero who's all about bringing the thunder. He's the go-to guy for ECT, but watch out, he's got a few side effects to handle, like myoclonus and hypotension. Still, he's indispensable when the sparks fly. And there you have it, our superheroes for induction. Each one has their own superpower, and together they make anesthesia the powerful, dynamic force we all know and love. So next time you're in the OR or ICU, think of yourself as the director of your very own superhero movie, and make sure you pick the agent wisely for your mission, because we all know, with great power comes great responsibility. Thanks for joining me for this overview of universal induction agents. If you found this video helpful, don't forget to give it a thumbs up and subscribe to You Learn Anesthesia for more content designed specifically for student AAs and future CAAs. Until next time, stay curious, keep learning, and sharpen those anesthesia skills. I will see you in the next video.